I was playing rugby down in South Carolina where I went to school, and big fella, about 6'1", 6'2", and a couple hundred pounds. And him locked knees, and I ended up tearing my ACL, LCL, and my PCL and stretching my peroneal nerve, which laid me up. It was my left knee that I injured. It was exceptionally painful. Never had as much pain in my life as at that time. I did go to some doctors down in South Carolina, and I did go through different sorts of procedures, and my family decided it'd be better to come back home, back up north, and do the procedure with Dr. Driscoll. Dr. Driscoll's an excellent doctor. I mean, he's really good, really easy to talk to, energetic, really enthusiastic about what he does, really proud of what he does. I was not able to move my ankle, and the doctors in South Carolina at the hospital didn't catch it in the least bit. Without having the conversation with Dr. Driscoll, there might be the issue of not being able to use my ankle in the future. This was a pretty intimidating procedure in recovery period. It was definitely pretty scary, not knowing what the outcome would be, if I'd be able to ever be as good or even do anything possibly what I used to do. They gave me a lot of confidence, letting me know that if I work hard, I mean, they said they couldn't guarantee that the nerve would ever come fully back, but they would definitely work with me on it. And knowing some of Dr. Driscoll's background and him being actually close with the family sort of helped things along, helped with my confidence in getting back into hopefully what I would be able to do. That sort of personal connection meant a lot. I was in the hospital for about 3 days post-operatively. The nurses were great. I mean, they would come in throughout the day and night to check up on me, to make sure everything was well, or as well as it could be. For my rehab, I was going to physical therapy 3 times a week. They worked me hard. They really were helpful, knowledgeable. They would be pushing you and pushing you and pushing you to get you back on your road to recovery as soon as possible, which I enjoyed because I like to push myself, and I wanted to get back on my feet. It took me about 3 to 4 months before I started being able to actually walk and do some physical activity. And I had started back to work, working in a warehouse where I'm constantly on my feet on concrete, lifting heavy weights. At that point, I was also starting to do some running and begin to play a little bit of sports, very lightly with a full brace on. I've referred a few friends over to Mid-State for their procedures, and specifically with Dr. Driscoll. I would refer him to anybody that has any sort of injury with knees, shoulders, anything of that regard. I had an absolutely great experience. I constantly look back and look at myself, look at my steps that I've made. I could only thank Mid-State and Dr. Driscoll and the physical therapy for getting me back to where I am. I do feel full confidence in my knee. No issues.